A messy house, strong smells, lack of organisation, poor hygiene are not moral failures of the client. They're exactly the reason why the client needs support. If this shocks you or makes you uncomfortable or disgusts you, maybe you need to rethink whether support work is actually for you. I'm Kim Matthews, Director of Sparkscribe Shift Notes and also to support providers. Lots of adults with disabilities or families who are already overwhelmed, sometimes with children or with complex needs, various things, they simply cannot keep up with the house routine and personal care. And it's not laziness, it's not neglect, it's not a character flaw, it's functional, emotional, cognitive or physical limitation. And that is exactly where the need for support comes in. So stick with me until the end. A necessary reality check for the sector is that support work is not just taking people to the shops, taking them to appointments, going out for coffee, keeping them company. Support work is also helping to organise the environment, supporting hygiene, helping to build routines, and restoring the dignity to somebody's life. It's extremely unpleasant and unethical to receive shift notes from support workers complaining about the house, the smell, the client, when that is literally part of the job. It's okay to record facts, but it is never okay to record judgments. If you don't have the emotional maturity or the professionalism or the stomach for this work, don't accept the client. It's that simple. Now, boundaries. Let's be clear, this does not mean support workers should accept anything. There are clear health and safety limits, and support workers should not be dealing with large amounts of blood or bodily fluids, feces or urine in contamination situations outside of the usual expectations of personal cares. They shouldn't be dealing with needles or sharps or any biological hazard without proper equipment and training. And it's not being fussy, this is work, health and safety. So what professionalism in practice really looks like is don't improvise. Don't expose yourself. Use PPE when you're required to and report the risk. Document it. Escalate to specialised cleaning, nursing or appropriate services via the provider, via the support coordinator. And professionalism is knowing what is your role and what has to be escalated. Support work is not about the support worker's comfort. It's about the participant's dignity. And it always has been. If you only want easy work, that's fine. Choose that. What is not acceptable is accepting a client and then treating their reality with judgment, disgust, or complaints. That is not professionalism. That is a lack of vocation.